Welcome back to my channel. This video is a continuation of our previous discussion on choosing a local issue. As an example, we have chosen diabetes and diabetes-related diseases in South Auckland. In this second part, we will explore the scientific perspectives on the topic. In order to understand diabetes, you need to first understand how your body processes sugar. Our bodies use glucose for energy. This is one of your body's primary fuel sources, along with fat and protein. Most of the cells in your body use glucose, along with amino acids, the building blocks of protein, and fats, for energy. But glucose is the main source of fuel for your brain. Without glucose, your brain wouldn't be able to work well. Cells use a process called cellular respiration to access glucose's energy. This process transfers energy from glucose into smaller molecules called ATP. One glucose molecule contains enough energy for 38 ATP molecules. The ATP provides tiny packets of easily accessed energy, which are then used to power all the cell's activities. Diabetes is a chronic metabolic disorder that affects the body's ability to regulate blood glucose levels. It occurs when there is a problem with insulin. Insulin is a peptide hormone secreted by the beta cells of the pancreatic islets. After a meal, blood glucose levels rise, triggering the pancreas to release insulin. Insulin binds two receptors on cell membranes, activating glucose transporters that allow glucose to enter cells. Excess glucose is stored in the liver and muscles as glycogen or converted into fat for later use. When insulin function is impaired, glucose remains in the bloodstream, leading to hyperglycemia or high blood sugar levels. Over time, this can cause serious long-term complications, affecting vital organs such as the heart, kidneys, eyes, and nerves. At this stage, we need to understand the role of another hormone called glucagon, secreted by the alpha cells of the pancreatic islets. When blood sugar drops, for example, between meals or during exercise, the pancreas releases glucagon. Glucagon signals the liver to break down glycogen into glucose and release it into the bloodstream. This ensures that cells still have energy even when food intake is low. In diabetes, this tightly controlled system breaks down, leading to chronic high blood sugar levels. There are several types of diabetes, but our focus in this video is type 2 diabetes, as it is the most common in our community. Type 1 diabetes, which affects up to 10% of people with diabetes. It is usually diagnosed in children and young adults, but can develop at any age. Type 1 diabetes is an autoimmune disease where the immune system mistakenly attacks the insulin-producing beta cells in the pancreas. This leads to little or no insulin production, requiring patients to take insulin injections for life. When you have type 1 diabetes, your body still breaks down the carbohydrates from food and drink and turns them into glucose. But when the glucose enters your bloodstream, there is no insulin to allow it into your body's cells. More and more glucose then builds up in your bloodstream, leading to high blood sugar levels. In type 2 diabetes, either the body does not produce enough insulin, or the cells do not recognize the insulin that is present. The end result is the same: high glucose levels in the blood, causing chronic hyperglycemia. Several factors contribute to the development of type 2 diabetes. Genetics plays a role, as having a family history of diabetes increases the risk. Obesity, especially excess fat around the abdomen, promotes insulin resistance. Additionally, a sedentary lifestyle and a poor diet, high in sugar, refined carbohydrates, and unhealthy fats, further impair insulin function, making it more difficult for the body to regulate blood sugar levels effectively. Obesity is one of the most significant risk factors for type 2 diabetes because excess body fat, especially around the abdomen, disrupts normal insulin function. This leads to insulin resistance, chronic high blood sugar levels, and eventually, the development of diabetes. In a healthy person, insulin allows glucose to enter cells for energy. In an overweight or obese person, excess fat, particularly visceral fat, stored around organs like the liver and pancreas, causes cells to become less responsive to insulin. As a result, the pancreas produces more insulin to compensate, leading to high insulin levels. Over time, the pancreas cannot keep up with the demand, leading to chronically high blood sugar levels and the development of type 2 diabetes. Obesity is a complex condition involving having too much body fat. Excess fat accumulates in the liver, leading to fatty liver disease. A fatty liver overproduces glucose, increasing blood sugar levels. This worsens insulin resistance, making it harder for the body to regulate glucose properly. Now, let us look at how diabetes affects the body. Diabetes has both short-term and long-term effects on the body. Hyperglycemia, or high blood sugar, can lead to frequent urination, dehydration, fatigue, and blurred vision. Over time, chronic high blood sugar levels can lead to serious complications. Cardiovascular disease is a major risk, as diabetes damages blood vessels, increasing the likelihood of heart attacks, strokes, and hypertension. Kidney disease, diabetic nephropathy, occurs when prolonged high glucose levels harm the kidneys, potentially leading to kidney failure. Nerve damage, or diabetic neuropathy, can cause numbness, pain, or tingling, particularly in the feet, increasing the risk of injuries and infections. Eye damage, or diabetic retinopathy, results from damage to blood vessels in the eyes, which can ultimately lead to blindness. Proper diabetes management is crucial to minimizing these risks and maintaining overall health. Prediabetes is a condition where blood sugar levels are higher than normal, but not high enough to be classified as type 2 diabetes. It occurs when the body starts developing insulin resistance or when the pancreas does not produce enough insulin to maintain normal blood glucose levels. While prediabetes often has no clear symptoms, it increases the risk of developing type 2 diabetes. These facts, when written in your own words or presented in your own way, can form the second part of your presentation, the scientific perspective on your chosen issue. In your next section or presentation, you will need to explore another perspective on this issue. Thank you, and we'll see you again very soon. In the meantime, happy learning and researching.